Daniel Hale Williams, surgeon who opened hearts and minds. Daniel Hale Williams was born in Hollidaysburg, Pennsylvania in 1856. An African American, he became a doctor and surgeon during a time when African Americans faced a great deal of racial prejudice in the United States. Slavery had ended in 1865, but African Americans were still denied many rights and opportunities. Dr. Williams dedicated his life to making sure that African Americans would not only be able to get good medical care, but would also be free to pursue medicine as a career. Early life. Daniel Hale Williams was born January 18, 1856. He was the sixth child in a family of 8 children. Daniel's father was a barber. He helped his father at the barber shop by keeping shaving mugs, brushes, razors, and scissors clean. He also learned to cut hair at an early age. When Daniel was 11 years old, a terrible tragedy happened. His father became ill and died unexpectedly. Mrs. Williams couldn't afford to raise her large family alone and had to split her family up. Some of Daniel's sisters went to stay with relatives. Mrs. Williams took 2 of her daughters to live in Illinois. Daniel ended up becoming an apprentice to a shoemaker in Baltimore, Maryland. He learned how to make and repair shoes. After some time, Daniel decided to move to Rockford, Illinois to be closer to his mother. In Rockford, he became a barber's apprentice. Then, as a teenager, he moved to Wisconsin to be near his sister and attend high school. At the age of 17, Daniel went to work for Harry Anderson, who owned the largest barber shop in town. Harry offered Daniel a place to live for free. Inspiration. While working at the barber shop, Daniel met a man named Dr. Palmer. Dr. Palmer was known to travel through rain or snow in the middle of the night to help save a patient's life, deliver a baby, or set a broken limb. Daniel was inspired by Dr. Palmer's stories and made an appointment to see Dr. Palmer to discuss the possibility of becoming a doctor. Dr. Palmer became Daniel's teacher. He taught Daniel and 2 other young assistants how to stitch up wounds, help set broken bones, and deliver babies. They watched Dr. Palmer amputate badly injured limbs when it was absolutely necessary. After 2 years, Dr. Palmer suggested that Daniel continue his education at Chicago Medical College, which later became part of Northwestern University Medical School. This school was one of the best medical schools in the country. Dr. Daniel Hale Williams. In 1880, Daniel Hale Williams traveled to Chicago, Illinois. He found a place to live, passed the medical school's entrance exam, and began his studies. Daniel spent 3 years at the Chicago Medical College. There were many advances in medicine during Daniel's time in medical school. The recent discovery of anesthesia helped doctors control a patient's pain and allow surgeons to do more complicated surgeries deeper inside the body. However, at the time, most surgeons did not yet understand that bacteria and other germs cause infection. Some doctors would probe wounds with unwashed hands or operate while wearing street clothes that weren't sterile. This lack of cleanliness caused more patients to die from infections than from their illnesses. Daniel learned about new methods to prevent these needless deaths, such as hand washing, sterilizing equipment, and spraying the patient and operating area with antiseptics. After 3 years of medical school, Daniel Williams graduated. He was now a full-fledged doctor. Although he had been the only African-American student in his class, he hadn't experienced prejudice while in medical school. When he began looking for a job, however, he ran into problems. No Chicago City hospital would accept an African-American doctor on its staff. So Dr. Williams decided to open his own practice. He continued to improve his surgical skills and learned better ways to reduce the risk of infection. Dr. Williams was known to keep the area where he did surgery spotless, whether it was in his office or in a patient's home. He often scrubbed the walls, floor, and ceilings of an operating area himself to kill as many germs as possible. As a result, hardly any of his patients got infections. Provident Hospital. Dr. Williams became known in Chicago as an excellent surgeon. Yet despite his reputation, he had a hard time getting any of his African-American patients into Chicago hospitals when they needed additional treatment. This was when he decided to start up a new hospital, one that would train African-American nurses, hire African-American doctors, and welcome all patients, regardless of color. Dr. Williams's hospital, which he named Provident Hospital, opened in 1891. Under Dr. Williams's supervision, Provident had a successful first year. In those days, most people ended up in a hospital died, usually from bacterial infections. In Provident's first year, out of 189 patients, 167 improved or recovered completely. Only 22 patients died. Open heart surgery. In 1893, 2 years after Provident Hospital opened, Dr. Williams performed an extraordinary operation. A patient named James Cornish was brought to the hospital. He had been stabbed in the chest during a knife fight and was dying. Dr. Williams suspected his patient's heart had been pierced and prepared to operate. At this time, there were no x-ray machines, blood transfusions, or bacteria-fighting drugs. Opening a person's chest to see if the heart was damaged was almost unheard of at the time and was extremely risky. But Dr. Williams felt confident. He had a staff of excellent doctors and nurses to assist him. Dr. Williams began the operation. He found James Cornish's heart just slightly pierced, but the pericardium, the protective sac that surrounds the heart, was seriously damaged. Dr. Williams successfully repaired the pericardium and stitched up Cornish's chest. The operation saved his life. Success. Newspapers across the United States quickly spread the news of Dr. Williams' successful operation. Suddenly, Daniel Hale Williams was famous throughout the world. In 1898, Dr. Williams married Alice Johnson. He was invited to work at other hospitals around the country as a surgeon and teacher. In 1920, he and his wife built a retirement home in the woods of northern Michigan. Dr. Williams was now able to enjoy his favorite activities, hunting, fishing, and swimming. Dr. Williams died in 1931 at his home in Inglewood, Michigan. He had been among the first surgeons to operate successfully on the area surrounding the human heart. Today, the 13-bed hospital he founded in 1891 is a large modern medical center. Daniel Hale Williams opened the doors of medicine to African Americans, and his career continues to inspire many people long after his death.